Okay, so welcome everyone to today's talk. Today we will talk about acutes, and acutes is the most difficult thing in homeopathy, and it needs a lot of art, a lot of technique, a lot of skill to know how to manage acutes. I've put together some thoughts, some ideas, as in how to use the acutes and how we can use acute as an opportunity to help the chronic state. First of all, we should have the confidence within ourselves that yes, the acute illnesses can be treated with homeopathy. We know homeopathy is beautiful for chronic illness. It's very good for psoriasis. It is very good for skin problems. It is very good for chronic degenerative illness. What we call in allopathy or in modern technology, modern world as cold illness. Cold. But I want to tell you, with my clinical experience and learning under the masters, that the acute is the best opportunity to treat the chronic case. It's the best opportunity. Whenever there is an acute, there is a panic. There is a crisis. Oh, it's an acute. Not just the patient, even the doctor is in an acute state. The question is what to observe. The most important thing I want to tell you is the importance of diagnosis. Whenever a patient comes in an acute state, first find out the diagnosis. Second, investigate. If he has fever, if the fever is more than 3, 4, 5 days, investigate him. Investigate him for Vidal, investigate him for malaria, investigate him for a CBC, for immunoglobulin tests. Then start the homeopathic idea as well. What is the exciting factor? How did it start? Did it happen after some mental setback, some ailment of death, some ailment of grief, some ailment of sadness? Or was there any aggravation by weather by affected by hot weather, cold weather, windy weather, working in water? Or whether eating something spicy, eating something oily aggravated it? But my main point today is in acute. Don't give arsenic. Don't give rust ox. Focus at the characteristics. The characteristic is the king. I'll give you one example of character. One patient came to me and she was in an acute state. She said, right now I'm getting a lot of headache and the headache is only better by doing like this. I have to keep my hand like this for about 10 minutes. I said, so is it like a pressure? After the putting the pressure you feel better? No, doctor, no. I feel better after putting the hand here for about 10 minutes. Bas aise. This was a symptom. So very beautifully you can see. Let's open here. I want to show you how I go about it. You can open your Fatak repertory. Let's have a look at Fatak repertory. And you can open pressure. So this is pressure, right? Pressure, ameliorate. But what kind of pressure is this? Is this a hard pressure? No. What they are talking about is a steady pressure. Can you see? Steady pressure ameliorate. And the remedy there being spigelia. And I'm telling you, spigelia helped that patient so much. And after that, I've used this rubric of steady pressure ameliorate. With spigelia, another remedy is nitric acid. So you need to differentiate between these remedies. The other symptom which is very important is modalities. You need to know when it increases, when it decreases, what increases it, what decreases it, in a very unprejudiced way. Let's have a look. I want to share with you an interesting case. This is a case of asthma. About a week back I got a call. Constant. He called me up at night at about 11 o'clock saying, I can't breathe, doctor. I have to take nebulizer inhalers for last 2. Can't breathe. Lot of wheezing, rattling. Patient was stated at Pune. I am in Mumbai. He said, I need to keep drinking water and lot of suffocation. And I'm walking, I'm restless, I'm anxious. I had given him arsenic 2 days back with indication of arsenic, but no change. So I used the repertory again. I said, respiration difficult after midnight, thirst often frequent, and his tongue was coated white. Again, arsenic coming. But interestingly, the second remedy which was coming was antim-tart. So what I did, I combined arsenic and antim-tart, and I gave him the remedy antim-ars, beautiful remedy. And when I looked at antim-ars, interestingly, the main symptom in boric is emphysema with excessive dyspnea and cough. So beautiful. And I want to tell you, within a day, his asthma stopped. Now I followed up for last 7 days. The inhalers, the nebulizers, all I stopped. The beauty of going deeper and finding peculiar symptoms. The importance of craving and aversion. Let's talk about this. One of the patient would tell me that whenever gets fever, whenever gets chill, wants to have cold drinks. And on that basis, I looked at this rubric. Cold drink desire, chill during. I checked his palms, feet, they were very cold to touch. On that basis, I gave carbo veg. Beautiful result. Just find the peculiar. The other important thing that we need to look at, state of mind. Very, very important, state of mind. And I want to tell you, this is the best opportunity to understand the state of mind in an acute. Why? Because normally when you ask the patient, how are you? He says, I'm good, doctor. Everything is good. But in the crisis, in the acutes, what we say is an uncompensated state comes out, a state which he has kept within, a subconscious state comes out. And this is the most important thing. What we say, a raw state, the real state within comes out. I will give you one example. The case of acute hematuria, about a 45-50-year-old man, suddenly bleeding. He came to the clinic. He said, doctor, make me well now. Give me medicine now. Make me better now. I said, okay, tell me about it. So don't ask me all these things, doctor. Don't ask me. Don't screw my mind, you moron. Don't ask me. Make me right now. Very interesting. I started using the repertory, and Fatak repertory is my main repertory here. I want to show you how I analyzed it. Let's have a look. I opened the first rubric for me was hematuria. That yes, this is a remedy. This is a remedy I want. Should have hemorrhage as the main thing. The second thing is he comes in acute. Now. The rubric for this is beside himself, madness, frantic. And the other thing he says, don't ask me questions. Don't ask me questions. I get very irritable. So irritable, questionment. And when I looked at these rubrics, have a look. The only remedy that comes through is Nux vomica. So interesting. And when I looked at Nux vomica, let's have a look here. Nux vomica. And you can see here, Nux vomica 30 is what I gave. I just told him take 2 doses. Second dose, and within 2 days the hematuria stopped. This is the beauty. Understand the state of mind. Don't give millifolium to hemorrhage. Don't give ipecac to hemorrhage. Understand the state of mind. Understand the peculiarity. Understand where he is, who he is. Understand the person in the illness. Another thing which is very useful for us, especially in acute, is dreams. To understand the person's dreams. This person would come to me about 21-year-old. His main problems were many. He would say that I get a lot of dreams. And the dreams that I get, especially what dreams I get, he says I get a lot of dreams. I asked him, what dreams do you get? He says that I get dreams that some gundas are waiting for me. That there are gundas and they are waiting for me and they'll kill me. They are all around me. The gundas are around me and they'll come and they'll kill me. Very interesting. So I started studying the repertory. Said, how do I understand this dream? And you know, in repertory, you can easily use the dreams for delusions. So what I did, very interesting this case, I looked at, he says there are a lot of people around him, right? So I said delusion, surrounded, yes. And who's surrounded? That uh, everyone is surrounding him. And who's surrounding him mainly? That's what my first question was. He said they all are ready to kill me. Just on this basis, I looked at the rubric. Surrounded by enemy, and everyone is enemy to kill me. I gave Mercury. You can see how beautifully. And Mercury helped him so beautifully. So now I want to come to the crux of the acute, and this is for a practitioner. I know there are many practitioners who are listening here. Generally, when patient comes in acute, there are different possibilities. One, either he's coming directly in an acute situation for you for the first time. First consultation, it's an acute. So he's coming for the first time in an acute to meet you. Second, maybe he's an existing patient. He's coming to you for the last 6 months, 1 year for a chronic illness. And now there is an acute. Another possibility, the third possibility is that the patient is coming. He's also your existing patient, a chronic patient, and he's not doing well so much. And you're trying different, but now he's in acute. The fourth possibility is a patient on a chronic illness who's coming to you, and he's now come in acute, but now symptoms are totally different. And finally, the patient has come in an acute emergency. I want to tell you the crux of my lecture for today. Focus at the present predominating state. Don't worry about who has said what. Don't worry about suppression. Don't worry about potency. Don't worry about repetition. Don't worry about state of mind. Don't worry about Sehgal method, Sankaran method, Vijayakar method, homeopathy method, this. Just be very calm, very relaxed, and focus at the present state. एकदम प्यार से बैठो और पेशेंट के साथ बैठो और समझिए कि क्या है ये पेशेंट क्या बोल रहा है. So let's start with the first. This patient and this situation, this is where a person has come directly in an acute to see. First consultation. So this is a case, I may have shown this before, but I'm going to just repeat this case. This case of a hypopion or keratitis, a huge ulcer in the eye. And when I saw this lady for the first time, you can see the eye, whole eye swelling. Hypopion. Absolutely unbelievable case. The Leelavati Hospital in Bombay diagnosed as an interstitial keratitis causing a corneal ulcer. Extreme amount of pain at night, lot of lacrimation. She couldn't sit in one place, constantly walking. She had to walk constantly. When I met her, the way she spoke was, "Hey, क्या है? इधर क्यों है?" I said, "I've come to treat you." He said, "हाँ, इधर से गरम निकलता है, रात को निकलता है, दवा तो दे दो. I get this pain at night." Very, very fast, the way she spoke. I asked, "Okay, tell me about your state of mind." He said, "Doctor, either you give me medicine or I'll just screw you." I said, "What do you mean?" He says, my language is only like that. Whenever my husband or my children, or my mother-in-law say something, I will just say something very, very bad to them. I don't care a shit about them." And he said, "This is only at night." I said, "Okay, what dreams do you get?" He said, "I get dream that my husband is troubling me and my mother-in-law is troubling me." I asked, "Okay, tell me what has been the stressful situation." She says, "Now this is the stressful situation." I said, "What else?" He said that a mother-in-law is torturing me and I feel like just abusing back. So this was the case, very interesting. Let's have a look. What is the first symptom? Very interesting. We can again open Pathak repertory. Let's open Pathak. The first rubric is that it's only at night. So time, aggravated, night. The second thing is that this particular situation, right, is called generally as chemosis. And finally, very interesting is the way she speaks. She speaks in a very, very harsh tone, abusive tone. So when we just repertorize this, you get the remedy Kali iode. And not just that, if you just open the rubric harsh, you get Kali iode. Look at this single drug rubric, so beautiful. So that's what I gave her. I gave her Kali iode. You can see here. And within 10 days, Kali iode, I believe I gave her 200, one dose daily. Within 10 days, her eye were normal. So this is when the patient comes in acute, her entire state will become so prominent. Let's talk about another possibility. What to do? What is the situation when the patient is doing well under your treatment, but comes in an acute? He's a chronic case, but comes in an acute. So this is a lady about 45-year-old. Her main problem was depression, but she had now come in acute. She said I was all okay, and she was under Piper methysticum 200. She said I'm all okay, but I'm feeling the same thing. I feel bored. I don't feel like doing anything. I don't feel like doing anything. I feel like just lying down. Again, I did very well last 2-3 months, but again I'm not feeling well. I said, okay, tell little more about what's happening right now. He said, I just want to go out. I want to enjoy. I want to relax. I want to party. I want to just eat great food. I want to eat pizzas. I want to go to the beaches. I want to enjoy. I'm feeling bored. So what I saw, that she was on Piper methysticum 200. But right now, very intense state is there. And what is the intense state? That she feels more bored. She wants to enjoy. So again, let's focus at the present predominating state. We open Kent repertory and we can open, let's have a look. We can open here ennui, which means boredom, and entertainment, ameliorate, enjoyment. Again, we see the remedy Piper methysticum. So very interesting. Again, we see Piper methysticum, which means that she still requires Piper methysticum. So what we can do, we can increase the potency, step up the potency from 200 to 1 m. So this is another technique. Sometime in an acute, the patient may require the chronic remedy in a higher potency. So I gave her Piper methysticum 1 m and I followed up for last 3-4 months and she is doing beautifully well. Let's take another acute. An existing patient who is not doing well but comes for an acute crisis. Let's have a look. This is a case of chronic kidney disease, renal failure actually, 45-year-old male, and he's under the remedy arsenic. Okay, he's taking the remedy arsenic for, you can see, last roughly about 6-8 months, but his creat has been increasing. His creat is 8.6. They are planning to do a dialysis. So right now he has come in acute. There is a lot of weakness. He doesn't feel like doing anything. Exhaustion, tiredness. There is a lot of hematuria. Constant state of anxiety. Constant anxiety. क्या होएगा? क्या होएगा? क्या होएगा? He's faced the suffering constant like this. I asked him what happened, what was the exciting situation, and what I observe is feet are very, very restless, constant restlessness. He says, doctor, I was all okay, but in the office, someone accused me of something. He accused me I have done something wrong, but I haven't done anything wrong. They accused me. I said, so? He said, I feel insecure. I feel insecure. What if they leave me from the job? What will happen to me? Will my job go away? Then will I have no money? Then what will happen to my family? I feel very insecure. This is the main thing, insecurity. So again, now you can again use the repertory, and I'm using Kent repertory here. Let's have a look. The first symptom is what is peculiar. The peculiarity lies in the restlessness. Very interesting. So I open restlessness of feet. And the second very interesting thing was his feeling that he has been accused. And when I just looked at these rubrics, I got a very interesting remedy, zincum metallicum. And then what I did after this is I started studying zincum. What is zincum? And if you see zincum, and if you see the periodic table here, You know, arsenic lies here in the periodic table, fourth row of the periodic table. You can see first row, second row, third row, fourth row, and in fourth row it lies here. And very close to arsenic lies zinc. You see how closely related arsenic and zinc are. So what I may have thought of arsenic may actually have been zincum. So you can see I gave zincum metallicum 1 m, just one dose, and I did a follow up after a month and then repeated after one more month. So his creat, which was 8.6, dramatically came to 6.6. This is the beauty of using the report. This is the beauty of understanding the state in acute. Importance of studying related remedies. There are many remedies which are related to each other. Lachesis is related to Crotalus cascavella to Horridius. Zincum is related to arsenic, calibrome, selenium. So beautiful. And I want to tell you, homeopathy is such a beautiful science. One life is not enough. I really want to tell you this. Okay, the fourth possibility is existing patient who is doing well on chronic, but now in the acute comes in a totally different picture. Let's have a look. This is case of pleural effusion. It's a known case of nephrotic syndrome, and under the remedy calcarea kappa, 16-year-old boy. And you can see here is been suggested, and you can see there is a total pleural effusion in the reports, and the entire chest there is water fluid. He's not able to do anything. He's on bed. Slightest movement he coughs, there is pain. He can't do anything. He's not able to, even if he's watching the TV, he's laughing. There is pain, and his mouth has become dry. His appetite has reduced. He feels frequently thirsty. There are no dreams. His sleep is, he feels like moving, but slightest movement causes aggravation. And he has become temperamentally very irritable. So again, let's see how I analyze this case. So he's on calcarea carb, fair enough. Now I have to look at what he requires right now. So we have to focus at the present symptoms. First thing, right now there is a pleurisy. So my first symptom, that chest pleurisy. I want a remedy which is very well known for pleurisy. The next symptom, slightest movement causes problem. So jarring aggravates. Next after this, very interesting, slightest coughing aggravates. What more? He feels frequently thirsty. Constant thirst. Constant frequent he feels thirsty. How much? For a large quantity. And his mouth is very dry. So when you just analyze this, let's have a look here. You see the only remedy that falls through is the remedy bryonia. And we know bryonia is so well known for pleural effusion. So I analyzed the case and I gave bryonia 31 dose daily. After 14 days, we did an X-ray again. And I want to show you the X-ray. You can see it's totally clean. No significant pathology seen. This is a beauty. In place like Bombay, pleural effusion treated totally with homeopathy, and the parents of the kid are ecstatic. They were asked to do a tapping. It's magical to see this. It's absolutely magical. Finally, I want to talk to you about the cases which will make your name, which will make a reputation for you. People will remember you for this case. They will remember, अच्छा वो doctor आए थे उसने ठीक किया. And I want to tell you, these are the cases that will make your name, fame, reputation. Take up this case. Take it up as challenge. This is a very interesting case that I did. This is a case of acute emergency. So, this mother of a famous of my student used to come to my clinic. Acute arthritis. 40-year-old lady admitted in global hospital. We don't know what happened. Suddenly she's admitted. I was called at night at 11 o'clock in global hospital in the ICU. Total her joints deformed, redness, sore, mouth deformed. They are saying it could be scleroderma. It could be connective tissue disorder. ESR very high, 100. So I told, tell me how it started. Sore throat, lot of sore throat with lot of cough, followed by joint pains, followed by little twitching. No one able to know what happened. I said, okay, no problem. Then I reevaluated. I asked, what about state of mind? I'm all okay. Mind state all good. Joints very warm to touch. Know what to do. We don't know what's happening. But there was a history of sore throat, a kind of infection, a streptococcal infection, followed by allopathic remedies. Then she developed a lot of twitching like chorea, and then she developed a joint which was stiff. Generally, history of sore throat, recurrent sore throat, followed by joint. Only one remedy, homeopathy. Streptococcinum. We need to learn these remedies. Streptococcinum 1m6 hourly, that we know in 2 days. And I want to tell you, this was one of the most magical days of my life. Within 3 days, the ESR was done, it was 30. And the patient was out of the hospital. I cannot show you this case on video because it's a homeopath's mother. Allopathic doctors couldn't believe the change. They couldn't believe it. And patient was out of the hospital within 3 days. Streptococcinum, and from then on I'm using streptococcinum so often. I want to tell you one more case of such which made a lot of impact in my life. Prolapsed intervertebral disc. 45-year-old man, bedridden at home in Juhu for 3 weeks, couldn't do anything. His entire body is like this. He can just move his hands. Very restless feet still. Feels very worried. I said, how did it happen? There was an injury. He fell down and then there was stiffness in the back. I asked him, tell him about your nature. So very anxious by nature, very restless. I said, tell more about this. He said, there was a huge money loss. And after that, I felt very worried. I said, what was the feeling there in the worry? So I felt very stiff, very cramped. I said, then? He said, from then on, I have become very, very superstitious. Arey, ye karu, wo karu. Arey, kali billi, a cat has gone in front of me. Is this a good day or no? There is a new moon today. Is this a good day or no? Very peculiar. So, this is very interesting that he has become very, very, very superstitious. So, you can open in the Kent repertory, fear, superstitious, and you can see a single remedy, Rustoxicodendron. And when you take this rubric, let's have a look and take the other rubrics: fear, superstitious, restless feet, injury of the spine, and stiffness. Only one remedy comes: Rustoxicodendron. And what happened after that? Let's have a look. Rustox, I gave high potency, Rustox 1m, because mind state is prominent. Once a day. And I want to tell you, within a month, the patient was able to walk and come. The back was much, much better. And he's still continuing the medicine, and there is a tremendous improvement. I want to tell you, this acute emergency homeopathy is magical. But, find peculiarity. Characteristic is the king of homeopathy. If you get characteristic, I assure you, any illness can be treated. There can be a lot of suffering which can be reduced. Fever. Fever is something we are scared of. But what is fever? Fever is actually a good sign. It is like a fight between the WBCs and the bacteria. It's a good sign. It means the immune system is working. Don't be scared of fever. What to do in fever? Sponging, fluids. Whether you want to use crocin or no. My suggestion to you, do not use crocin. I want to tell you this. Why? I have seen many cases who, due to fever, has taken crocins and have landed up in chronic renal disease. Stop using crocin. But handling acute is an art. What is the art? Accurate reporting. Constantly be in touch with the patient. Regular, frequent reporting. And calling the patient frequently to your clinic. I made a list of some common remedies which I use. Let's have a look at them. China. I use China very, very often. What is the symptom of China? There are 4-5 symptoms. If I get that, I give China. A bitter taste in mouth. Hunger increased in chill. A lot of chills. wants to lie down, and a feeling of persecution. मेरे साथ ही क्यों हुआ है, मेरे साथ ही क्यों हुआ है, मेरे साथ ही क्यों हुआ है. The next remedy which I use very often, arsenic in acutes. What is it? Very restless. But especially he will say, I feel like drinking water. And when he drinks water, he says, kadwa lag raha hai. There is a craving for oily food. And Tim Tart, I use this another very often. Especially a lot of rattling. But the three keynote, Nash trio, thirstlessness, dullness, and white tongue. Gelsemium is another thing. But what is the key of gelsemium? When you ask them to open the tongue is trembling of tongue, and wants to hold on to someone. Staphysagria, I use this very often, especially when there is a history of lot of insult and suppressed anger causing physical problem. Think about staphysagria. Colocynth, acute colic with shrieking, shouting, spasm after insult. And finally, this remedy I am using very often, arnica, after any injury, sore, bruise, pain, but especially after dental operations. Whenever operations are done, bladder operation, rectal operation, I give arnica. Instead of antibiotics, I give arnica. Beautiful healing. So in operations, I use this. Pre-operative, before operation, I give gelsemium to patient so that the anxiety levels etc. are less. And post-operation, for the infection, instead of antibiotics, I give arnica 200. The most important thing in follow-ups, the frequency of follow-up. So you have to be in touch with the patient constantly. Evaluation, is the patient still the same remedy? Focus at the present state. You might have to change remedies. How do you know patient is doing well? The first signs will be appetite will come up, sleep will be better, energy level will be better, the state of mind will be little calmer. Potency, this question often people ask. When to use high potency? Potency has to be used higher when the mind is more prominent. If the generals are more prominent, I use 200 potency. And if there is no peculiarity at mind and physical level, use 30 potency. Boning Hussain approach, use 30 potency. Don't be afraid to repeat. I repeat very, very often 6 hourly. It's important to know relationship of remedies as well. For example, patients who require calcarea at a chronic level may require belladonna in acute. Patient who requires sulfur at a chronic level may require aconite in an acute. Patient who requires sepia at a chronic level may require nux vomica in acute. Generally, to the patient, I give a very small medicine kit which have the common remedies. This help a lot. But I want to tell you that the patient generally will not like to take homeopathy in acute, because in their mind it is that homeopathy is only for chronic cold, skin illnesses, piles. We need to educate, we need to make them aware. Education is our responsibility. We need to call our patients for a regular educational seminars. The most important trust is cooperation, trust. And I want to tell you, this is what I have seen. Before homeopathy, if the patient is getting acute so often in the frequency, with homeopathy, this will go down. It is the best opportunity to treat a chronic case and develop trust in homeopathy. If you treat an acute of a patient, he will remember you for life. And I have learned this by Dr. Sankaran's approach. I've been with him, I've seen him how he does it. Be an example. How to be inspiring others, be an example of inspiring others. And he constantly tells me that the secret and care of the patient is to care for the patient. You have to have a realistic care. You have to have a realistic emotion. A real care is what is needed. And finally, the only remedy in the world for the sick is love. I know this sounds very strange from a person who just talks about repertory, but I want to tell you what the patient needs. What a sick person needs is love, is care, is affection, is warmth. And with warmth, with lot of care, even the suffering, there can be healing. So I want to tell you all doctors there, it's the care, it's the love we need to spread. You can get in touch with me. This is my email ID, gaurang@gmail.com. And finally, I want to finish with telling just this one thing, that really the secret in care for the patient is to care for the patient genuinely. Thank you.